Welcome to our presentation. My name is Cimbria Lewis, and I appreciate your kind attention as we talk about the clinical procedures for CAUTI prevention. The purpose of this policy is to outline the steps that Top Choice Hospital should take to prevent the development of catheter-associated urinary tract infections in our catheterized patients. Catheter-associated urinary tract infections, or CAUTIs, as we will refer to them in this presentation, are the largest group of hospital-acquired infections in the United States. There are roughly about 1.7 million hospital-acquired infections reported in the United States every year, and of that, 450,000 of those are related to indwelling catheter use, or CAUTIs. As such, this presents a significant economic burden on our healthcare system. Insurance companies do not cover the cost of treatment for hospital-acquired infections, such as CAUTI, because they are considered to be preventable. And as such, we as nurses and healthcare providers have a responsibility to minimize that expense and the incidence of these infections. 15 to 25% of all hospitalized patients are expected to receive an indwelling urinary catheter at some point during their stay. That means that roughly a fourth of our patient population is at risk for CAUTI right now. As such, CAUTIs can present a significant risk for bladder infections, kidney failure, and even sepsis, to name just a few complications. The purpose of this policy is to minimize infection incidents, and also it has a scope that applies to not only all catheterized patients, but it also includes all providers that will care for those patients, so nurses, assistive personnel, and the providers such as doctors and nurse practitioners. We proposed that we would have an educational training team that would come and provide education for these providers to give them the best possible skills and techniques to prevent CAUTIs from affecting our patient population at Top Choice Hospital.
Hello, my name is Taylor, and I will be presenting the ABCDs policy. It is the policy of Top Choice Hospital to prevent CAUTI development by establishing a bundle protocol that increases patient safety, improves quality of care, and improves the financial responsibility of the hospital. This bundle protocol we are presenting is called the ABCDs policy. It includes the education of nurses about appropriate indication of catheters, instructions for a thorough baseline assessment, up-to-date tools for catheter care, appropriate situations to discontinue a urinary catheter, and the implementation of specialized catheter insertion teams. This policy is aimed towards minimizing infection, improving patient outcomes, and minimizing preventable hospital expenses. So we will now introduce each element of the ABCDs policy. A is for appropriate indication, B is for baseline assessment, C is for catheter care kits, D is for discontinuance, and S is for specialized training. The B in this policy stands for baseline assessment. A proper baseline assessment should be performed upon admission to our hospital here at Top Choice and should include a thorough health history assessment. Nurses should also perform a baseline assessment of the perineal area and should document initial skin color, integrity, and other characteristics like odor, drainage, and discharge.
My name is Willey, and I'm going to start introducing some of the letters of our ABCDs protocol. The first being appropriate indication. Basically, we want all of our nurses in the hospital to be inserting Foley catheters not for short-term use or out of convenience, but because the patient actually needs an indwelling Foley catheter. We're also wanting them to think critically and think of alternative methods if possible for all of our patients. All of these indications are valid for a patient to receive or to have a Foley catheter inserted to help the bladder empty more fully and effectively to prevent urinary stasis or any kind of like urinary tract infections. Some of these indications include urinary retention or obstruction, strict output measurements either bedside or intraoperatively, surgery longer if the patient's in surgery longer than 2 hours, for continuous irrigation, chemotherapy if the drugs need to go directly into the bladder, if the patient is recovering or healing from an open sacral or perineal wound, we would want to keep the urine away from that site so the wounds may heal. if the patient has been immobilized for a prolonged period of time, and also for palliative and end-of-life care for increased comfort. Again, all of these indications would be a reason for someone to have a Foley catheter inserted to help them prevent any infections or issues with their urinary tract.
The baseline assessment should also include palpation of the lower abdomen and accurate vital signs. Nurse's assessment of the lower abdomen is important in deciding how long the catheter should be in place and if it should be removed. For patients with an initial urine volume of 200 cc's or less, nurses should prepare for immediate catheter removal. Any volumes greater than 200 cc's, other clinical relevant information should be considered when deciding to catheterize or not. Abdominal and perineal assessments should also be repeated daily during a patient's bath, and any variations from the baseline assessment should be documented, specifically any new signs of infection.
Okay, I'm now going to introduce C in the ABCD's protocol, catheter care/kits. We're basically wanting to make sure that all of the kits in all of our units throughout the hospital have complete components, and that the sterile components remain sterile in those kits, and that also the nurses are taking the proper cleansing measures, like cleansing the surrounding skin and the genital area before catheters are inserted to prevent CODIs. All of these components should be included in our kits. So that would include a sterile indwelling Foley catheter with the smallest bore size possible to prevent irritation or inflammation in the tract to prevent CODIs. Also, 10 milliliters of sterile water to inflate the balloon to make sure the catheter stays in place. Chuck's pad, sterile drapes, sterile chlorhexidine wipes 2 to 4%, again to cleanse that surrounding skin. And if these chlorhexidine wipes are contraindicated for allergies or burning, we can also use sterile water or antimicrobial wipes. In addition to these supplies, sterile water-soluble lubrication should be in the kit as well to help the catheter enter the urethra more smoothly. Sterile drainage bag to collect the urine, and also a tape or securement device to keep the catheter in place and prevent it from coming out of the urethra.
I'm Carson Rushing, and I'm going to talk about the last two letters in our acronym, discontinue and specialized training. It's important that we discontinue the catheter as soon as possible to minimize the risk of infection in the urinary tract. And there's three indications that it is appropriate to discontinue the catheter. These include bladder decompression is no longer necessary, that the patient can void by themselves, or that there's an obstruction in the catheter. And there was actually a study done in North Carolina, the surgical trauma unit there, and when they had the nurses be the ones to implement this discontinuation of the catheter, it was more successful in reducing CODIs. Numbers went from 59 in the pre-intervention period to 16 in the post-intervention period, because nurses are the eyes and ears of what's going on with the patient, and they know best when it's time for this catheter to be discontinued. The last letter in our acronym is for specialized training. And so in nursing school, we all learn how to put catheters in lab, but not everyone has the opportunity to do this often actually in the clinical field. So it's important that before RNs are putting catheters in, that they're well educated in how to do this appropriately to reduce CODIs. So we have training meetings here at Top Choice Hospital that you'll need to attend before March 1st, 2022. And if you're a new nurse, there's also additional policy meetings so that you can learn more about how to reduce CODIs here in the hospital. There was also another study done in Toledo Medical Center where they had a specialized group of RNs that were specifically trained to putting catheters in, especially in difficult situations with men or obstructions, or the first attempt was a failure. And so if you have any questions or concerns about putting in a catheter, you can go ahead and call the specialized team here at Top Choice Hospital at 801-717-7704. Thank you so much for listening to our presentation.